Hello and welcome to our live stream on firearms and mental health. It's part of our month-long effort to celebrate Mental Health Awareness Month, and we're so glad you've taken the time to join us live or via recording. Today, we hope to provide information to help you understand how to keep yourself or someone you care about safe from firearm injury, whether that's self-inflicted, accidental, or intentionally caused by someone else. I'm Kara Gavin with the Michigan Medicine Department of Communication. A note for everyone watching, we will be discussing topics related to suicide and self-harm today, and may discuss issues that could be triggering to survivors of all types of violence. If you would prefer to watch later or read a transcript, we'll make those available. And of course, if you or someone you know is in crisis, please call or text 988, the National Mental Health Crisis Hotline. We are so fortunate today to have 3 University of Michigan experts who can help us understand what we know and don't know about the intersection of firearm use and mental health, including substance use disorders involving drugs and alcohol. We also want to help firearm owners and those who live with or might be visiting firearm owners understand specific steps they can take to protect themselves and others. We'll also touch on Michigan's new firearm laws as they relate to mental health. All 3 of our panelists are members of our medical school faculty in our Department of Psychiatry. Dr. Cynthia Ewell Foster is a clinical child psychologist by training and leads several efforts to study risks for firearm injury and death and try and reduce them, including a very innovative program in Michigan's Upper Peninsula that we'll ask her to explain. Dr. Victor Hong is a psychiatrist specializing in psychiatric emergencies, and he directs the U of M Psychiatric Emergency Services team that runs our 24/7 emergency department and hotline for people in mental health crisis. And Dr. Mark Ilgen is a psychologist who directs the U of M Addiction Treatment Services clinical program. He's also with the VA Ann Arbor Health System, and he's done research on the links between substance use disorders and firearm injury and death, especially in veterans. He and Dr. Ewell Foster are members of the U of M Institute for Firearm Injury Prevention, which is co-presenting this live stream. Thank you, all 3 of you, for joining us, and thank you to the U of M Alumni Association for also supporting this live stream. Before we start, a few housekeeping items. If you're watching this live, you can submit questions at any time, and we'll pick some to be asked during today's chat. Questions can be submitted by commenting on the video on whatever platform you're watching on, but please note that your name and profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via the Facebook direct message function on facebook.com/Michigan Medicine. We know that there may be many questions, so we will likely combine some that are on the same topic. And please know that our experts can't give specific advice for an individual situation that you might be facing. And if you can't stay for the whole chat or you want to share the recording with a friend, you'll be able to do so after the live stream ends through the Michigan Medicine YouTube channel. So I'd like to start by asking each of our experts to talk about a very sensitive topic, but a very important one that they've all studied and worked to prevent, and that is firearm suicide. I think it might surprise many people watching that more than half of the deaths from firearms in our country are suicides. More than 26,000 people in 2021 alone. And if you look at those 26,000 firearm deaths in another way, as a portion of all suicides using any means, firearms are involved in over half of all suicides. So could each of you reflect on what we know about who's most at risk of attempting suicide, especially firearm suicide, and what factors raise this risk? And what do we know about specific evidence-based steps that someone can take to reduce their own risk or their loved one's risk of dying by firearm suicide? And I'd love for anyone who's ready to answer to start first, and we'll go to the other 2.
Yeah, I can speak a little bit to the risk factors for suicide and use of firearms in suicide. So, there are a lot of factors that we consider clinically. There are things that are demographic risk factors, such as your age, your race, ethnicity, marriage status, employment status. But really, when we're talking about clinical work and clinical evaluations, especially in an emergency situation, those are not the factors that we can and should be using for a clinical decision. And really what we're looking for is sort of more imminent or short-term warning signs. These are things such as evidence of a severe mental health crisis, worsening severe depression, hopelessness, if somebody is not able to sleep, having a break with reality, such in the case of psychosis, escalating and significant substance use, withdrawing from friends, and obviously other kinds of communications like writing suicide notes or posting things on social media that are worrisome. So these are the real things that we look at in terms of making decisions clinically and understanding how to intervene.
And I would just echo what Victor said, that our thinking about suicide and suicide prevention has really evolved over the past 15 to 20 years to be less focused on clinical conditions and more on specific and changing risk factors. So there's really an emphasis placed on understanding how's the person feeling in the moment, and then what types of situations are increasing their risk or decreasing the risk at any given time. And those are the conversations that are a big part of the care that goes on in PES, or the Psychiatric Emergency Service. And firearms end up being a part of that conversation, and understanding of how people have access to firearms, and what they're thinking about their firearms, and how that looks at any given time. And so it used to be that clinicians didn't do a lot of talking about firearms, but more and more, as there's been an emphasis on understanding some of these changing risk factors, that has encouraged a broader discussion of what sort of immediate circumstances is the person in. And because suicide is so closely linked to firearm access, talking about guns and whether someone has access to guns has become more and more a part of that clinical conversation.
Thanks, you guys. I will jump in and just maybe offer a little bit of a broader kind of a public health response to that question about, who's at risk. I think we all know that suicide, thankfully, is a very rare event, but of course it's a tragedy whenever it occurs. And I think we're seeing some really concerning increases nationally in the suicide rate. And so I'm really grateful that people are here today to think together with us about this issue and how we can all be a part of the solution. I think, I always think that it's sort of important when you look at public health data and you look at, these mortality numbers, and you kind of try to drill down and understand who's at most risk. So I just want to elevate a few things for folks. So here in Michigan, about 68% of our suicide deaths are in middle-aged men, which is really a concern. But we also see some subgroups that have really elevated risks. So our elderly population are actually at very high risk of dying by firearm suicide. So I think that's really important for all of us to think about, our grandparents and, folks in our neighborhood that might be alone and struggling with health issues. I'm a child clinical psychologist, as you mentioned, and so I think a lot about what's going on with our kids. We're seeing some really alarming increases in suicide mortality among young Black children in the United States. And so that's giving us a lot of pause. Certainly our Indigenous, First Nation, tribal youth, that's really our highest rate of suicide in Michigan and across the US. So I think what's interesting to think about is that how important data is. And so if you're in a position of being able to look at data and think about how we're going to allocate our prevention resources, these numbers are really important. And I love to see in Michigan that we're using these kinds of numbers and thinking, what are we doing to support the elderly? And what are we doing to support our tribal communities? And what are we doing to support Black kids in our urban areas? And I also love that my colleagues who are providing that clinical support understand that population level risk is really important important, but you never use that to guide your human interactions with people that are in our emergency room or in our clinic, because then that's just a human being and a human being. It doesn't matter what group you're in, but everybody deserves that same kind of careful assessment, which I know Victor's team does 24/7.
Yes, they do. Thank you all. And actually, just to reiterate, if anyone's watching this and is having thoughts of suicide or self-harm, or worried that someone they care about might hurt themselves with a firearm, the number to call or text is 988, and that will connect you with someone who can help. I actually had a second part to that initial question that I probably should have saved to now, which is, what are some specific steps that people can take if they have firearms or access to firearms, or are going to be in a home where firearms are present and they are concerned about someone or themselves having using those firearms in a self-inflicted kind of way? Dr. Hong, I think if you could speak to what you're doing in the psych emergency about providing some things and screening for gun safety.
Yeah, I can certainly speak to that. If I could skip a little forward and also go back a little bit and to talk a little bit about why we're even talking about firearms, or why it's such a focus. Obviously, as Carrie had stated before, firearms is by far the most common method of suicide, not only in this state, but in our country. And the reason why it's such a focus, and I'll go into sort of some safety measures here in a bit, is because number one, it is very accessible. So the vast majority of the population in this state especially has either a firearm in the home or access to a firearm through a friend or family member. The second is that this suicide method is so irreversible. And so if you juxtapose this method of suicide with, for example, overdosing on medications or pills, which is by far the most common method of suicide attempt, there's a speed and irreversibility of firearm usage that is very unique to that method. So if somebody uses a firearm and the gun is fired, there's over a 90% completion rate, which is juxtaposed with overdosing on pills, which is less than 2 or 3% completion rate. And the reason for that is fairly simple. If you overdose on pills, for example, maybe the dosage of the pills that you took was not sufficient to cause severe injury or death. There's time, the mechanism of which that injury or death occurs, there's time to intervene. And when we're talking about the science of suicide, what we're really trying to do is we're looking for ways to intervene when somebody is in a mental health crisis. And again, the speed and irreversibility of firearms is unique and doesn't allow for that intervention to occur. So one of the things that we really harp on is, number one, to kind of balance the conversation with our patients and their family members, and to say that we're not in the business by no means of taking away people's guns or punishing people for owning firearms. That's not really the point. The point is really that when somebody is in a mental health crisis, when it's clear that those imminent warning signs are there, that temporarily those firearms need to, at the very least, be secured in some form or fashion. We can talk about all the different types of firearm safety, whether it's locks, whether it's storing ammunition separately, whether it's using safes, whether it's giving it away to a friend or family member temporarily. But what we do a lot in the psychiatric emergency services is first to screen for firearms. And so we do now ask every patient that comes in, regardless of their risk factors, whether they have access to a firearm, and if they do, how that firearm may be secured. And that allows us to then launch into a conversation, if indicated, about how to store those firearms more safely.
Great. Thank you so much. Dr. Foster?
Yeah, thank you, Victor. That was, I just wanted to add, again, from the youth perspective, that, a lot of what we're trying to do with a comprehensive public health approach to suicide prevention is to create communities that are aware of the mental health challenges that people in our communities might be facing, right? And know what are those warning signs and how can we identify people who are at risk and get them to help. And I think as somebody who thinks a lot about kids, I am so passionate about this issue about firearm injury prevention because with young people, we're in a declared youth mental health crisis right now in our nation. We have a lot of kids who are hurting, and sometimes they tell their parents that they're in trouble and they need some help, but sometimes they don't. And kids are really good at keeping things private. And and you don't, as a parent, you don't want to find out that your kid is in trouble if their first sort of, attempt, they can get access to a firearm, right? It just totally prevents our ability to meet their needs and move these kids into recovery. And, this is a heavy topic today. I really realize that, but it's important to me that we be sharing messages of hope with the folks who are listening. And, I want to say really clearly, we have so many tools in our toolbox in the United States right now in terms of suicide prevention. Mental health treatment is really effective. Psychotherapy, medication, so many other even non-healthcare system related interventions for kids, connectedness, making sure kids know they're important, they matter, that they have reasons for being here. So when we can find out soon enough that somebody is in trouble and get them help, we can move them into recovery and wellness. But if people are struggling and they get their hands on a firearm, it just removes our ability to do that. And so it really speaks to this issue of everybody has a role to play in suicide prevention in this country. And one of the most important things we can all do is to be sure that we're storing our firearms safely, that we're really controlling who has access to them. If you look at kids in this country who have died by suicide and you look at where they're getting those firearms, they are getting them from people who love them. They're getting them from their house, their parents, their grandparents, their aunts and uncles. And, none of us want to have that, have that responsibility for a young person that we love. So.
Thank you so much, Dr. Ilgen.
Yeah, and I appreciate Cindy mentioning that there is a message of hope here and a lot of reason for hope. And she's talking at the kind of policy or societal level. I think on the individual level, the same thing is true, where we've learned a lot about what a suicide crisis looks like for people who are struggling with suicidal thoughts and becoming more and more severely suicidal. And even those who make serious attempts, we have an understanding of how they describe that suicidal crisis. And for the most part, it looks like a curve. If you picture your typical bell-shaped curve. And for some people, that's a really long, slow buildup and then a kind of flatter curve. Other people, it's pretty flat to begin with, and then it spikes really suddenly. And we've developed and continue to develop new and creative strategies to help people who are suicidal. And many of those boil down to getting someone safely through that curve. For people, as they start to enter that process, what we're looking to do is be aware of that and look for how we can intervene and how we can help keep them safe. And so the scary thing about firearms and other highly lethal means of suicide that can be accessed really quickly is that if someone enters that upward slope at a time where they have very easy access to something that's very lethal, that's when things get very concerning quickly. And so even things that I think sometimes the general public say don't seem completely foolproof as means to just slow access. Buying yourself a few minutes or hours before someone might act on a suicidal thought can make all the difference in helping to keep someone safe and getting someone through that curve. So now that they're feeling a little better, they can take a step back and talk about, what are some of the strategies they can invest in to improve things overall, not just in the moment.
Great. And I think in the preparation for this chat today, Dr. Hung, you recommend we try and bring up the phrase lethal means safety. And I think that's what we're talking about here, right? It's making it harder for someone to have immediate access to something that could be deadly were they to use it on themselves. Is that what we're talking about? Are there other things that you are, besides locking up firearms or keeping ammunition separate, are there other aspects of lethal means safety you want to mention?
Yeah, so when we talk about lethal means safety with our patients and families, it is somewhat unique to each individual in each situation. However, I will say that anecdotally, the three things we usually talk about are among the most common or lethal methods for suicide, which are firearms, pills, medications, chemicals that people could ingest, and then sharp things with which they can injure themselves. But again, obviously, if somebody is having some kind of plan or method of suicide that involves some other kind of means, then we, of course, discuss that as well. And we have an open and honest discussion about, we strategize sometimes on the fly about how can we either get these things out of the house, lock them up, temporarily keep them safe, et cetera.
And if I could, Kara, I just, I want to jump in because I hear a myth commonly in the community when we're talking about lethal means counseling, which is, if somebody really is interested in ending their lives, they're going to find a way to do it, right? And it doesn't matter if I have a firearm or not. It's not about the gun, or it's not about and actually the data is pretty clear that that's not true. So there have been a number of studies that have looked at people who've made medically lethal attempts, so much so that they needed to go to the hospital, medical setting, get treatment. And then we follow those people over time. Something like 95% of those folks are still alive decades later. So the idea that, if you make an attempt and you survive that attempt, you're just really likely to stay here with us over time for decades. So that idea of being in that crisis and not being able to get your hands on something that's lethal is so important. When I talk to young people about this, and I kind of try to explain, the metaphor that I often use is, when you're like at the beach, and you're kind of standing there and you're watching the waves come in, and every once in a while a wave will come that you weren't expecting and sort of knocks you down, right? And so when those waves come, if it's really hard to get your hands on something, you're just much more likely to keep your head above water, right? We know that when folks are really in that suicide crisis that Dr. Ilgen was talking about, that our problem-solving skills aren't that great, and so if we have that delay, folks are more likely to just sort of give up that attempt in that moment. So that's what we want. We can get them that support.
That's great. Thank you so much. What a great metaphor. Just a reminder to our audience that we are monitoring the platforms where we're live streaming for questions from you. And if you'd like to type in a question, we'll try and address it or combine it with other questions. Or you can send us a private message through the Michigan Medicine Facebook page. So I'd love for each of you to talk about some of the specific work you're doing on this topic. Dr. Ewell Foster, you've been doing some great work in the Upper Peninsula and also helping community hospital emergency rooms across the state with suicide prevention. And can you talk about that? And then we'll ask Dr. Hong and Dr. Ilgen to talk about their work.
Yeah, I'd be happy to. Thanks. I'm going to start with Michigan's Youth Suicide Prevention Emergency Department Network, and Dr. Hong is involved in that work too. That is a collaboration between the Michigan Department of Health and Human Services and my research team and Victor's great team at PES, and it's sponsored by the Garrett Lee Smith Memorial Act, a SAMHSA grant that we have here in Michigan. It's really been an acknowledgement that, as we mentioned, we are really in the midst of some concerning numbers of mental health concerns among our nation's youth, and our clinical safety net isn't quite where it needs to be. And so we're having a lot of kids and families come into emergency departments trying to get help for suicide risk. And many of our colleagues in emergency departments are amazing emergency medicine physicians, but maybe don't have the behavioral health resources that they need to manage this demand in kids and families. And so this has just been a really nice opportunity for us at the University of Michigan to try to give back to our colleagues, across the state and try to do some training and technical assistance. Certainly counseling on access to lethal means has been a huge part of what we've been doing. We've been supplying gun locks for different emergency departments and really trying to help providers get comfortable having these kinds of conversations that Dr. Hong's team is having every day in PES. It can be daunting, I think, as a provider to ask families these questions about, do you have a firearm? It's a sensitive topic for folks. It can feel intrusive. You don't have a relationship with folks in an emergency room. So it's just really important to try to build that capacity in our workforce. So we're doing that through our Youth Suicide Prevention Emergency Department network. We're also doing that with our CDC-funded Preventing Suicide in Michigan Men grant, where we're leading a statewide implementation and evaluation of this counseling on access to lethal means training for providers across the state of Michigan. So really, really privileged to have the opportunity to try to support our workforce, taking better care of people who need help. And then in terms of our project in the UP, that also really came out of our SAMHSA grant, and it's just been a great collaboration with the Marquette County Health Department and my colleague Sarah Derwin, who's a public health educator in the Upper Peninsula. This project really is about understanding, the point that I made before, which is that suicide risk isn't equitably distributed in the US, and there's pockets of places that are higher risk. And so right now in the United States, our rural communities are seeing really increasing and elevated risk of firearm suicide. So kids who live in rural areas are actually at double the risk of a firearm suicide than kids who live in suburban or urban areas. And so trying to think about how to have prevention conversations with families in rural areas where firearms are such an important part of the culture there, really important part of family activities and, hunting and, and also just there's just a tremendous amount of, pride in being a responsible firearm owner in many of our rural neighbors. So Store Safely is an intervention that's designed for families with kids in rural areas, that was developed with the community and really thinking about the idea that when we have these conversations, when we can elevate the strengths in a community and work alongside a community to figure out, who do you want to hear the safety message from, and what should it say and not say, and what's the best way to reach people, it's more impactful. So if you are listening and you're in Michigan's UP, look for Store Safely coming to a neighborhood near you. We've just been funded by the CDC to do a large-scale trial. So I hope if you see those flyers that you'll participate in our evaluation.
Fantastic. Dr. Hong, do you want to mention anything else that's going on in our psychiatric emergency department? I think you're also giving away gun locks, correct?
We are. Just share a few things. We've learned so much over the years, both here at Michigan Medicine, but also just in the suicide prevention community, in terms of what is evidence-based for suicide prevention, especially regarding firearms. And so there's a few things that we've come a long ways, even in our psychiatric emergency services, in terms of implementing some of those evidence-based interventions. I'll just name a few. I mean, first of all, you have to ask. You have to ask questions. And I would say that it wasn't that long ago that the types of questions that were asked and the way in which they were asked was highly variable. We're trying to standardize that. We're providing trainings, again, as Cindy was saying, about counseling on lethal means, so that we're not coming at individuals and their family members, coming on too strong and basically threatening to take away their firearms. That's not our purpose. Our purpose is to have a good conversation, educate about firearm safety, and kind of going from there. So that's the first thing. The second thing is, implementing safety planning for all individuals who are in a suicidal crisis. And so that involves, what are the risk factors? What are warning signs that a crisis is coming on? Who can you talk to? What are things you can do to kind of soothe yourself? What are professional outlets you can reach out to, like 988? Another thing that we've implemented, again, as you mentioned, reducing the barriers to safe storage. So we do give away free gun locks. I know that the VA hospital has done that as well. And a lot of health systems are doing that. Oh, hey, you can't afford it? Here's a free gun line. Here's 5. Here's 10 if you need them. Yeah, contacting law enforcement who are willing to store temporarily firearms, and trying to connect patients to their friends and family members who may be able to temporarily store those firearms. And then something which is a somewhat new intervention, but quickly becoming the standard of practice, which is following up after the emergency visit by some way. And so what we do in our psychiatric emergency services, we actually call patients and their families after discharge from the emergency department. How are you doing? Did you make it to that mental health appointment? Talking a little bit about lethal means. Are you still having thoughts of suicide? And in many cases, we have actually invited them back because they're still in a suicidal crisis.
That's fascinating. Thank you. Dr. Ilgen, I'd love to hear more about what you've done in the veteran population or other work related to substance use issues and firearm.
Sure. Well, maybe to start with substance use, that's a topic that we've been looking at for a while, trying to understand the ways in which using drugs or alcohol, and in particular, heavy use of drugs and alcohol, might be linked to greater risk for suicide. About 15 to 20 years ago, I'd say that substance use was a pretty understudied risk factor for suicide. In training and when talking about who was at greatest risk, there was often a discussion of folks with mood disorders like depression or bipolar disorder, but not much mention of substance use. And our initial work in this area just kind of grew around documenting that link between having a substance use disorder and being at greater risk for suicide. And that likely relates to a number of factors, probably some genetic loading, also the fact that substance use disorders in particular are impairing, like any mental health disorder, and they're stigmatized, and those can make someone feel more likely to be suicidal. But there are some other unique factors with substance use, in particular, that they're often impairing, and they can make your judgment a little cloudy, just by definition. And when we were talking earlier about those curves, or that what a suicidal crisis can look like, it seems like drug and alcohol use has a uniquely strong relationship to what are often referred to as impulsive suicide attempts, or times when someone goes from not thinking much about suicide at all to engaging in a suicide attempt. And the data on this is really still just emerging. There's a colleague here named Courtney Baggy who's done a lot of work documenting this link between alcohol in particular and suicide risk. But there are a few studies showing that firearm suicides in particular might be closely linked to substance use. And so that the mechanism there is likely the fact that someone can, if they're progressing rapidly from not thinking at all about suicide to engaging in a suicidal behavior, that's more likely to occur if they're using substances, and more risky if they have access to a particularly lethal means like the use of a firearm.
Great. And anything about veterans and what the VA is doing, or VA research?
Yeah, I'd say in veterans, all of the issues that we've been describing here are particularly salient. If firearms are involved in the majority of suicides in general, they're the vast majority of veteran suicides. So over 70% of veteran suicides involve a firearm. And there are likely many factors related to that. Some of it may just be the demographics of our veteran population. And there's also the fact that veterans are more likely to own a firearm and to be more familiar with firearms. And that too can increase risk. And then there's other features unique to the veteran population, like prior exposure to violence and PTSD, which could be also particularly problematic. So the VA has I think, really been on the forefront of conversations about the link between firearm access and suicide risk, and trying to come up with solutions. I think the VA knows that firearms are extremely important to their members and to our veteran community, and that they really doing something that could help requires having an open dialogue and making sure that veterans feel that their access to firearms will be respected, that the things they enjoy about using a firearm and firearms in their community can still be in play, but there need to be ways to maybe slow access. And in particular, that the VA, I think, has been creative about linking veterans to each other. That sense of shared community and looking out for your buddies is very strong in the military and also in veterans. And looking out for someone can include helping to store their weapon, helping to connect them to gun shops that might be able to store a weapon on site, and providing that peer support. And it's not always smooth, but the goal would be to have really an honest dialogue about how to understand when someone's becoming particularly high risk, and then help them store their weapons for that period of time, and then also be able to support them in getting their weapons back, so they know that if they do use let's say a gun safe or something at a friend's house, that's not for, in perpetuity. They can get the gun back in the future.
That's great. Thank you so much. We actually had an audience question that kind of gets at what you've been talking about. Several of you, this idea of the lethal means, reduction or access reduction, and identifying what lethal means might be in someone's house, whether that is a firearm or knives or whatever. And to what extent should this be happening before someone has been in a crisis? Maybe they've just got a general diagnosis of depression or anxiety or PTSD. Should this be a part of that kind of treatment for those kinds of conditions?
Yeah, it's a really good question. It's interesting. I've talked to colleagues who are from other countries, including Canada. In many of these countries, they really do not ask about firearms regularly, whether that's because the access to firearms is less than is here, or it's used less in suicides. But it is so prevalent here. Access to firearms is so prevalent, and the use of firearms as a method for suicide is so common, that we have decided, in our institution, and I think just as a mental health field as a whole, that it is 100% of the time you're seeing a patient for a mental health issue, you need to screen for access to firearms. We've tried to implement that here.
Thank you so much.
And I would also, just to jump in, from a kid perspective, that this isn't just a mental health issue, right? If we're talking about firearms, those of us who are parents have had our pediatricians ask us at our well child visits if we have firearms in the home, and get some education about safe storage. Safe storage is an evidence-based risk reduction intervention, not just for suicide, but for unintentional firearm injuries in little kids, for intimate partner violence, community violence, school shootings, right? We want to have control the access to firearms, right, in general. So that's really what I think of as like a primary prevention strategy. It's a universal prevention strategy. Like, that's something that we all can be doing to have safe communities for folks. And you shouldn't necessarily need to be in the emergency room with suicide risk for somebody to be having that conversation with you. So I think it's like, when you think about a prevention model, like, there's things that all of us can do. And then when you hit a threshold of additional risk, then there's other things, that we need to do. And but I think really, thinking about, I'm wondering if some other folks who are listening have had the school district that my kids go to ask us to sign a statement at the beginning of the school year with all the paperwork. Hey, if you're a firearm owner, are you storing safely? It's just a good reminder about how to be sure that, everybody is safe.
Great. We've been talking a lot about suicide really briefly, since we've got a lot of questions remaining. Other kinds of violent acts related to firearms, whether that's road rage or interpersonal and intimate partner violence, or school shootings, all that. What do we know? What don't we know about the relationship of mental health conditions to those kinds of other incidents that are not self-directed?
I think there's a few important things to point out. So a lot of times when there is violence towards others, there is a implication that, well, the person must be mentally ill. And, unfortunately, counter that narrative, people who have a mental health disorder, especially a severe one, are much more likely to be the victims of violence as opposed to the perpetrators. So there is that myth that I think that needs to be dispelled. But regardless, one of the other things to mention is that the correlation between the risk factors for violence towards others as in association with suicide risk factors, there's actually a lot of overlap, which is why, when we are asking about suicide risk factors, we're also asking about risk factors for violence to others every single time. Of course, there is a phenomenon sometimes in terms of murder-suicide where somebody has decided that they do not want to keep on going and they're going to take loved ones or others with them, unfortunately. So this is the reason why in our screening process, in our evaluation process, we kind of tie the two evaluations together.
Thanks so much. Let's talk for a little bit about Michigan's new firearm laws. They just took effect in February, and one of them is known as the Red Flag Law, though the official name is Extreme Risk Protection Order, or ERPO. Could any of you just discuss briefly what this involves? How can someone use this new law to protect themselves or someone they know from firearm injury, including potential suicide? And I think my colleagues who are monitoring our social media channels are going to put the link for that free toolkit that our Institute for Firearm Injury Prevention has on their website. They're going to put those on the social media platforms so that anyone watching will be able to access that website. But if any of you could just discuss briefly, what is this law about? Who's it for? And do we think it's going to help reduce these kinds of incidents?
I can start and say, extreme risk protection orders are an evidence-based policy intervention to prevent a host of adverse outcomes with firearms. And I think there's a couple things I want to say. I would really encourage folks who are interested in learning about this to go to U of M's Institute for Firearm Injury Prevention website, look at that toolkit. One of our nation's experts in ERPO evaluation is here at the University of Michigan, April Zioli, and she definitely worked very closely with our legislators in getting this legislation written so that it would be evidence-based. I think it's really important for folks to know that there are checks and balances and legal checks and balances as part of this legislation. And so, it's not like someone is going to show up at your house and take away your firearms, right? So there are checks and balances. But again, for someone who has worked clinically with families and has sat with, for example, mothers of young adult males who have high risk for suicide. This individual had a high risk for suicide, and I can just pull moms up in my memory who said, I'm so worried, I've asked him to get rid of his firearm, and I feel like there's nothing I can do. The fact is that often the people, when people are at risk, their loved ones are worried about them. And so this is just another tool in our toolkit to help folks who are concerned wrap around somebody who's at risk and try to support them. That's how I see it. But I encourage people to check out this toolkit. And I don't know if you guys have other things you want to say.
I'll just add a few other things and reiterate a couple things that you had said. So we've already learned quite a bit. This law went into effect in February, so 3 months ago. And so we were involved in the first case in our county, Washtenaw County, of a case in which this law was implemented. And in that case, it was a fairly obvious case. And in petitioning the court, that individual did have firearms removed, and I think it was a good idea. But to reiterate something that Dr. Foster was saying, which is, this is not for these like mild cases. This is not an effort to remove firearms from law-abiding citizens who are low risk, minding their own business. This is really for people for whom there are numerous red flags, risk factors of potential harm to self and others. And I think we're going to learn a lot in the coming months and years about how this will be implemented from the legal perspective, law enforcement, mental health clinicians, and the community at large, because it's going to be tested in different ways. What are the criteria that need to be met? Are different judges going to look at this differently? Are different jurisdictions going to look at this differently? And so these types of cases, I think, will be instrumental in how effective it is moving forward.
Great, thanks so much. And you mentioned that the courts are involved, and then also there are expiration dates on these removals, correct? This is a temporary measure. That's also important to note, right? Great. There's another new law in Michigan also that's looking to reduce firearm injuries and deaths, especially among younger people. And that allows for firearm owners who don't store their firearms securely to face criminal charges if that firearm is used by a young person to hurt themselves or others. Do you think that's going to make a difference? And how can firearm owners make sure they follow that law?
I'm going to take that one, guys. Happy to. Yeah, so again, child access protection laws or CAP laws have been implemented in other states prior to them, becoming law here in the state of Michigan, with strong results. There's clear evidence that safe storage in a home setting reduces unintentional injury, firearm suicide, community violence, a host of adverse outcomes. So yes, I think there's just to clarify, again, the legislation in Michigan is if you are a firearm owner, and again, the vast majority of firearm owners are very responsible, and really it is important to them to have a safe home and to teach their children safe handling and to have family rules about kids' access. So, I think there are many, many firearm owners in the state of Michigan who are already doing this. It's just another tool in the toolbox. And so it does, indicate that there is a misdemeanor if you have, reasonable expectation that there would be a minor in your home, you own a firearm, and if that child gets access to that firearm, if the child gets access to the firearm and someone gets hurt, that's a felony. But there also are, in similar legislation that was passed at the same time, tax breaks for families to make safe storage equipment more, financially accessible. And there has also been a real significant commitment at MDHHS to make, cable locks and trigger locks available to families. So if folks feel like they need that, great places to start would be your local public health department, your local law enforcement office. There's often lots of free resources. Project Child Safe would be another place where folks can order safe storage equipment online. But
Great.
yes, it is, just another tool in our toolbox to have, protective environments.
Excellent. Excellent. Thanks so much.
Just if I could just add a few other thoughts. Obviously many of you may be aware that the both parents of the individual who perpetrated the Oxford school shooting were recently convicted of manslaughter. This is the first time that a case like that has occurred and had that legal outcome. I would say that while it's not totally related, it's a very extreme example of this kind of situation. I think it'll be very interesting to see in years coming that what effect that will have also on individuals and giving individuals kind of pause and should I be storing my weapons safely? I think it's, again, as Dr. Foster has mentioned, another way to educate people and have a little bit of more teeth behind consequences for not having firearms stored safely.
Thanks so much. We're coming to the end of our time. Dr. Ilgen, I wanted to tap into your expertise on substance use addiction issues and firearms. Is there anything else you wanted to mention about what we know or don't know or need to learn more about on the intersection of firearms and substance use disorders?
You know, the one point that I would highlight is that, and I think is somewhat unique to substance use. It's probably true of most mental health conditions. And that is that feeling like you're a burden to others is an important risk factor for suicide. And unfortunately, historically, and still some when it comes to people who are struggling with their substance use, there's an expectation or a belief that part of the role of people in their lives is to speak up and tell people about the damage they've caused with their substance use. So you see this in popular shows like Intervention, and historically a lot of drug and alcohol treatment programs really spent a lot of energy trying to remind individuals who struggle with substance use of some of the damage that's been caused, and either kind of cajole them into echoing that back, or telling them, bring in others to point out some of the ways in which drugs or alcohol have caused problems in their lives. And my belief is that that is harmful in terms of drug and alcohol treatment outcomes. I think it doesn't lead to people doing better long term, but I particularly worry about it when it comes to mental health symptoms and suicide risk. And we don't have a lot of evidence of this, but there is some indication that that just that sense of being a burden is particularly problematic when people have a drug or alcohol problem, especially when they relapse, which can occur after participating in substance use disorder treatment. And so one message that we've tried to get out there, and I think is important to reiterate, is that if you care about someone who struggles with substance use, and as you're talking with them, try to understand how they're coping with that burden and how they're feeling, and look for ways where you can communicate in a way that's supportive, trying to encourage them to reach out for help, reminding them of available resources, but looking for where's that line where maybe you're kind of layering on a sense of burden. And if that seems to be happening, some people will speak up when they are feeling that way. Ask about thoughts of suicide and look for ways of connecting them to resources to support them through that period of time.
That's fantastic. Thank you. I think that's a really important point for anyone who knows someone going through this kind of treatment. Before we come to the end of our hour, I'd love to ask you if you have thoughts or closing remarks or things about research that needs to be done, because I know there's been a shortfall of research funding on firearm issues and firearm injury prevention tactics. And so, if you want to each take a couple minutes to talk about what you hope will happen, what you think needs to happen to make more progress on this issue. Dr. Ewell Foster, do you want to go first?
Sure, I'm happy to. I will just say that, firearms are the leading cause of death for kids in the United States at this point. And if we look at our national research investment in other causes of death, as you noted, our investment in understanding how to prevent firearm injury, suicide, and all the other types of firearm injury we've talked about today has been lacking. I'm really happy to say that that's changing. But we would be here for the rest of the afternoon if I listed all of the work that needs to be done. So I think what I'd like to do, if this is okay, Kara, is just sort of end with a little bit of again, a message of hope for folks. Just remembering that, I do suicide prevention, and I think sometimes we can get hopeless and, really kind of, throw our hands up a little bit and in concern. And, I just want to remind people that there is a lot of reason to be hopeful. And it's so important to get comfortable having these conversations about mental health. May is Mental Health Awareness Month, about firearms, in the same way that our society has gotten real comfortable saying to one another, like, hey, I think you've had too much to drink. I'm going to take your car keys and how about I run you home? And that's a socially acceptable thing to do now in this country. And I think we need to work on getting there, around mental health and being able to normalize, like, I really care about you. I've noticed these changes in you. Being able to say the word suicide. I'm wondering if you're thinking about suicide. How can I help you? So much of what we've learned about how to protect people is about these caring behaviors, person to person. This is what our Lifeline does for folks, that when you call 988, these how do we prevent people from feeling like they're a burden? We actively work to be sure they feel like they have belonging and connectedness. And that's something that we can all do for the people, in our homes and in our communities. So, I just want people to feel empowered that they can do two things. They can reach out and ask, and they can make sure their firearms are stored safely. It's
fantastic. Really thank you. Dr. Hong?
Yeah, just real quick, I think we've done a lot of work in researching evidence-based interventions, mental health interventions to reduce suicides, and we'll continue to do so, and it's important to do so. But I think to really turn the tide and reduce the suicide rate in this country, we're never going to have enough doctors, enough therapists, enough, figure out the right medications to make enough of a difference. And I think that's why we need the assistance of really common sense community-wide interventions. And I think firearm safety gives us a tremendous opportunity to make a real dent in this, really enormous public health problem, one that affects all of us.
Thank you so much. Dr. Ilgen, you get the last word.
I agree with what's been said. I guess I'll end with a hope. My hope is that we can have greater dialogue between the suicide prevention community and the firearm advocacy community, because I think that we have a lot of shared interests and shared goals. If you're a firearm advocate, somewhat by definition, you care about the lives of firearm owners. And unfortunately, I think that those groups haven't talked very effectively together. I think some of, like Cindy's project, for example, is trying to build bridges between those communities. And I think we just need more of that. People own firearms for a reason. And I think we need to start with that as an underlying assumption, understand the rationale and the ways in which firearms seem to serve people's needs, and then figure out how can suicide prevention interventions get built into that and built on that framework. If someone believes they need to access their firearm quickly for their own personal protection or safety, how do we understand situations where we can hear that perspective, but also provide them with ways to keep the rest of their family safe and maybe themselves safe if they're feeling like they're having a tough time in the future.
Fantastic. Thanks so much. Thank you to our audience for watching. Thank you to my colleagues who've been monitoring for questions and posting links. And if anyone wants to give feedback on this event or join the email list to get more information from U of M about mental health topics, or the email list for the Institute for Firearm Injury Prevention, those links will be in the social media platforms where you're watching this, and we hope you'll sign up. And we thank everyone for joining us, especially our three experts. We hope that everyone who watched even part of this will share the video with others. And thank you so much. And everyone have a good rest of Mental Health Awareness Month.